Thank you so much. So I'll quickly introduce myself and then I'll let Jessica and Melissa introduce themselves. So my name is Serene. I'm from Connecticut, Central Connecticut, and I'm a rising freshman in college.
Hi, I'm Jess. I am from Long Island, New York, and I'm a second year student at Northeastern University, and I use she, her pronouns.
Hi, I'm Manasa. I'm from Cincinnati, Ohio, so the Midwest, and I'm an incoming freshman at college too, and I use she, her pronouns.
Yeah, and I also use she, her pronouns. I'm gonna share my screen so you can see my slides. Okay, so I want to quickly go over who we are as an organization. So we're a student-run organization called the Revna, and we were formed because during March, COVID-19 came in, and then a lot of college students were sent home, and we didn't really have much else to do at home. And in the frenzy of professors trying to keep their classes together and people trying to figure out what exactly is happening, we decided a bunch of students decided to basically collaborate online and form an online network where we can collaborate and work on projects together. And so right now we've expanded to include to help a lot of students turn their ideas into reality. And so our mission is to help student innovators translate their ideas into real world impact. And we do that through a lot of different ways. We have initiatives that we start. We also have research projects that we take on, like the COVID and climate project that we have. And a little about who we are. We are a nonprofit of over 1,000 students across the world. And so it's a really global community, and there's a lot of different perspectives being shown. And it's a really great place to learn about different people from different communities, and also pick up different skills as well, like research skills, data science skills. And a little bit about how we do things. We really focus, so a lot of our work falls into three big categories. One big category is incubation. So we help start projects basically. So students come up with ideas and we help provide them with structure, and also a lot of times the team members to make that project to help that project become successful. And we really leverage our network of students. Students come from a lot of a variety of universities across the world. And so we really help provide them with resources to get started. And another thing we do is we really focus on helping students get opportunities within research. So we want to make research more accessible, because a lot of things can be done online. You can learn a lot online, and you really want to leverage that and help students, just learn a lot online through research groups. And the third thing that we do is we really hammer in on our connections, and how we have a lot of advisors that help us with our projects, because obviously we're students, we don't know much about the fields that we work in. So having people kind of bring in their expertise and their experience working in the field really helps us make sure that our projects are grounded in the real world. It's not just an academic endeavor. And so we started a couple of different initiatives. We have the coronavirus visualization team, which is where this current project is based in. We also have Panel to the People, and the Panel to the People is more like a public educational initiative where we host Zoom webinars featuring different speakers to talk about a subject. And we purposefully invite panelists from a lot of different backgrounds to have the conversations that usually are not being had. And really trying to leverage the variety of perspectives. And so we also have a lot of other initiatives that I'm not going to really go over, but we also have partners that really help us with making sure that our students are doing real work in the world. And some of our accomplishments, we've helped coordinated the donation of 350K articles of PPE through one of our partners, Supply Crate. And we've also connected a lot of students with research opportunities at other educational institutions and also within our organization. And that's our funding page. We're not going to look over. So much of our value, we really stick to make an impact through student-led innovation. And our value lies in the success we've had in helping students work together in an online environment and be able to work in whatever interests them, like policy proposals, data science, viz, and research briefs. And these are our board of directors, which I'm not going to really go over now. And I'll turn it over to Jess and Monica to go a little bit deeper on why they decided to go with their project. And I'm going to stop screen sharing, but like, how did they come up with the idea for their project?
Hi, so I'll share my screen. Can you guys see this presentation? Okay. Oh wait, I'm going to present mode. So how we started COVID and climate. Okay, sorry. We started, initially Manasa and I found coronavirus visualization team through different ways. I found out about it through a friend. I'm not sure how she found out about it, but somehow we came together. We had never met before. I'm from New York, she's from Ohio, and we both have different interests. I'm really interested in environmental justice research at university. I do research around a Green New Deal, and Manasa is really interested in public health and seeing the intersections of that with other fields. So we came together and we want to pitch a project. So we came up with COVID and climate through seeing how our interests merge and the intersectionality of all the different fields. Manasa, do you have anything else to add to that?
Yeah, for sure. It was definitely it definitely came about due to our collective interest in environmental justice and public health. But alongside that, there was a really cool research study. It was basically preliminary findings that were published kind of back in March by the Dominici group of the Trans School for Public Health. And they found this really interesting relationship between fine particulate matter exposure and COVID-19 mortality rates, which we'll talk about a little more. And we wanted to really investigate that and think about how it may be affected by other factors too. And that's kind of our inspiration for the specific focus of this project. But I've got to say, like, it's just been so cool working with everyone. And the next slide, like, Jess has like the names and where everyone is from, but it's just really created this wholesome community that we've been able to work with. And I'm just amazed by what we've been able to do and the conversations that we've had, well, not like meeting each other physically. And I'm just kind of constantly inspired and learning from others. And I'm glad to have found this group.
All right, so here's a little bit about our project, a little project overview. The focus of our project is to investigate the effects of the COVID-19 pandemic on pre-existing economic and social inequities propelled by climate change. And something a lot of our team members learned was that the groups that are most affected by the climate crisis are often the groups that are most affected by the COVID-19 pandemic because of these existing disparities in healthcare, in environmental health, and other factors that affect people's vulnerability to COVID-19 and the severity of their cases once they get it. So our aim was to evaluate the effects of the COVID-19 pandemic on Massachusetts specifically, to kind of zoom in and view the factors that may most contribute to COVID-19 and the trends that we see given environmental justice backgrounds and health backgrounds using census data, demographic data, COVID-19 data, and any other pollution point sources or non-point sources that we found along the way. And ultimately, our goal is to enable policymakers and everyday citizens to see the effects of these different factors on each other, the trends, and ultimately to inform everyday people about what could be going on in their communities or other communities that are nearby. So what is environmental justice? According to, I'm sure many of you already know this definition, but according to the EPA, it's the fair and treatment and meaningful involvement of all people, regardless of race, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. So this comes into play because we see how typically middle income bracket white Americans have more say over what polluting sources are in their communities, and they're able to push out factors that may contribute to pollution, such as power plants, major highways, because they have the means to do so through coming together, whereas minority groups might have a more difficult time doing that because of health, language differences, or any other difference that may come into play, community spaces. So the focus of our project was to investigate the environmental justice and injustice trends within Massachusetts to see how this affects us now in the pandemic. So our approach started with a few weeks worth of literature review. We looked at several countless studies that looked at air pollution and inequalities, the relationship between the COVID-19 pandemic and inequities, air pollution versus all these different factors. And then we use all this data to inform what we wanted to analyze and what we wanted to visualize. So we identified relevant data sets. A few of our data analysis members got experience with things they never would have had experience with, and they ran statistical tests and found conclusions from these tests. And then ultimately, these things from the second half of our project also informed the last stage, which was the visualization stage and summaries, where we created visualizations using ArcGIS and R and Tableau, and we also are finalizing a summary document where we summarize the trends that you guys will all see on the next few slides. So this took us about 4 months. We started in early April, and it's just incredible to see where we've come, how much we've all gotten to know each other and just learned so much about how all these different fields intersect. And we're excited to share the rest of the slideshow with you.
All right, so more about what we did. So like I mentioned in the beginning, our group's project was greatly inspired by the preliminary findings of the Dominici lab group, and I guess it's this box in green. And what they found was that a 1 microgram per meter cubed increase in long-term PM 2.5 exposure was associated with an 8% increase in COVID-19 mortality rate. And they found this after looking at data across the United States and after controlling for a number of different confounding factors, from obesity levels and smoking levels to population density and the stringency of the lockdown measures. And so like what we wanted to do was to really further investigate their findings and kind of see all the various variables that are affecting each other. And what we chose to explore was PM 2.5, like the group. So what is PM 2.5? It's a mixture of very small solid and liquid droplets that are under 2.5 microns in diameter. So you're talking like 1/8 or so of a hair follicle, so super tiny. And they're released by fossil fuel combustion and even fires and lots of other things like that. And we looked at PM 2.5 specific data, specifically through using the EPA ground monitors. And there's multiple different ways in which PM 2.5 data can be represented. Like sometimes it's collected in the ground level, sometimes it can be collected by satellite, sometimes they use a mixture of both of these methods to create different models to predict them. And we just decided to utilize like years worth of PM 2.5 exposure data on a county level. And we wanted to look into the health outcomes, the COVID-19 hospitalization rates, and we did that by looking at the mass.gov dashboard. And we took a number of different confounding factors, just explore them in depth, like the population density, poverty levels, and several other factors. And I think it's also important to acknowledge certain limitations of studies and the work that we're doing as well. So one important thing to remember is that like the trends observed in a population level aren't necessarily transferable to the individual level, the ecological fallacy, and that's something just to keep in mind. Second thing is that I guess we didn't really take into consideration how multiple air pollutants may affect each other and may, compound, and that's another thing along with the other limitations listed. So here are a few examples of like the initial like charts and graphs that we created to kind of look at the various interesting things that are going on in terms of air pollution and in terms of PM 2.5 and COVID-19 rates. So here are a few interesting graphs. You can see in the upper left-hand corner one that you can see the progression of PM 2.5 in Suffolk County and why that might be occurring. You can see how the number of COVID-19 hospitalizations vary from different counties to county. In the bottom right corner, you can see how non-white populations may be associated with higher COVID-19 hospitalizations as well. And you can see this full bimodal distribution, which kind of shows how hair quality differences might be associated with different levels of COVID-19 hospitalizations. And here are a few more visualizations. So the point of these was just to kind of explore the cool trends that are out there to kind of get a better sense of what we could explore in depth. And again, we see how non-white population ratio is associated with a higher number of cases per county, and how counties who have had multiple, days since like the first case, there's like a greater number of cases. That's kind of like the epidemic curve, and other factors like that, which we'll go into talk about more.
So I'll give Manas a quick break from a few more slides that she'll talk about, but this slide goes over the next set of visualizations, which shows Massachusetts as a map and the different trends. And so what our deliverables was that in the initial stages of this project, we had a Medium publication that is still running through the coronavirus visualization team. But initially, a lot of COVID and climate members contributed to articles that went over what climate refugees are, what environmental justice is, and other articles that wrap around our interests as they relate to coronavirus, inequities, and environmental justice. And then some of the briefings that we've done are defining environmental justice, defining sources of air pollution, such as sources from energy production and energy usage. We have a document that goes over a county level data extraction of the slides that you'll see in the next few minutes. And ultimately, we're concluding a research brief that will also more formally describe the trends that you'll see in the next few slides. So what is the story map? Here's a quick link to it if you'd like to access it yourself. But some of the factors that we've been talking about, you'll see as overlapped, as different layers that will be overlapped with each other's, such as COVID-19 case rate per 100,000 people, PM 2.5 levels, race, socioeconomic level, English ability, major roadways and transportation sources, and contamination sources.
So I'll go through the first few sets of slides. So here in this first layer, we have air quality data versus case rates by town. And what you can see is that both the levels of PM 2.5 exposure and COVID-19 rates per 100,000 people tend to increase towards the eastern side of Massachusetts, specifically in towns like Brockton and Boston. And I guess this, while the map just depicts the trends, an important thing that might be that might be happening underlying these is the fact that PM 2.5, a lot of research has established that PM 2.5 is a risk factor and does contribute to a number of different cardiovascular and respiratory conditions. And in that way, it may be associated with increasing susceptibility to COVID-19 rates. And this really propels us and calls a need for more research looking into the relationship. Oh, okay. So with the legend, I guess this legend, this map specifically shows like two different factors that are working together, and what it shows is if it's purple, you can see it has both high levels of PM 2.5 and high levels of COVID-19. If it is kind of that off-white color, it has low levels of both. And if you kind of go through the legend, I guess the arrow that points to the right, I guess depicts more information about PM 2.5 levels. So that shows that like the PM 2.5 levels like increase as you go towards the right hand side, and I guess COVID-19 rates with like the diagonal key, they increase as you go towards the left hand side. So yeah, it is a little confusing, but it just kind of shows how both of these factors interrelate on this map. Next, we decided to look into some of the racial and demographic factors. And the reason why we wanted to do that is, as you guys have probably been hearing, as well as some recent statistics show, that compared to white's latest US age-adjusted COVID-19 mortality rates for Black individuals is 3.6 times as high, and for Indigenous people, it's 3.4 times as high, and for Latinx members, it's 3.2 times as high. So there is this inequity that is kind of clearly apparent, and seeing these conclusions that are being reached by other reports and other groups, it made clear to us that we needed to include demographic information in any visualization that we created. And as you can see,
Did I accidentally mute somebody? That was my mistake.
no problem. Okay. You can kind of see how in the first map, which shows COVID-19 versus the percentage of Black or African American members in a student population, that there is this strong positive correlation between COVID-19 rates and higher percentages of Black populations. And similarly, if you look in the lower map, you can see this correlation between the percentage of the population whose income is below the poverty level and those who are testing positive for COVID-19.
Yeah, and then next we wanted to look at roads and road location and whether that correlates with COVID-19 cases. The thought process behind it is the more intersections there are, so like in the big road intersections or railroad intersections, there's more people and there's also more pollution. And so we were thinking like, okay, do these locations have more COVID-19 cases, especially the communities surrounding those big road intersections. And so we really mapped that out, and we mapped out road pollution and also COVID rates of the respective counties, respective towns, sorry, not counties, towns. And we found out that there's a strong positive correlation between railroad intersections and high COVID-19 case rates. And on the bottom visualization, you can see that with each circle that indicates a big pollution site caused by railroads. And so trains, they produce high amounts of particulate matter from combustion of diesel fuels. So we really found out that a lot of the places that are affected with like high COVID-19 case rates, they're also where there's pollution and where there's major road intersections. And that also happens to be where the big cities are, like Brockton, Boston, Worcester, and Springfield. And then on this slide, on these visualizations, we added another layer of data. We added demographic data to like what we were looking at on the previous slide. So here we really wanted to see what kind of people make up the population in these counties that are affected. And we found out that major railroad pollution areas and road intersections and high COVID-19 case rates, they oftentimes overlap. They also oftentimes happen at the same time when there is also a high Black or African American population proportion of the population. So we realized that all these factors oftentimes overlap at the same time. Often we can't really say that, okay, if there's an intersection, if there's a road intersection, therefore there has to be, or it causes high COVID-19 case rates. We can't really talk about correlation, we can't talk about causation here, but there is a strong correlation. And so we really think that this can guide discussion further because whenever you talk about social policies or social issues, you really have to think like, okay, there's different groups of people that are being affected, and also the road intersections happening at the same time.
All right, so the next set of factors we investigated was more pollution point sources such as power plants, Superfund sites, and other contaminated sites called activity and use limitation sites, or AUL sites for short. Superfund sites are where hazardous waste was dumped, left out in the open, or improperly managed, and these sites were selected by the EPA to receive funding for their cleanup and remediation of the land. Our visualizations show that there's a positive correlation between power plants density and the percent of the population that is Black or African American. And the same trend holds true for Superfund or AUL sites and communities that have high percentages of Black or African American populations. And so something we would like to look into the future is including the factors, the data for Latinx populations, Indigenous groups, and Asian Americans. And these maps are significant because they show that these polluting sources tend to be located where minority populations live, which is an environmental justice concern. And so this can serve to raise awareness and raise questions for why these sources might be located where they are, and how can these communities that are located in these very polluting locations band together and make sure that their health is prioritized. And so our last set of maps is on this slide, and these show that some of the contaminating sources, like the Superfund sites and the AUL sites, might be correlated with COVID-19 case rates. These pollution point sources emit greenhouse gases like carbon dioxide and PM 2.5 into the atmosphere and into the neighboring communities, which puts people at risk for having more severe cases of COVID-19 if they get that. And in similarity to the previous slides maps, these show that the areas that contain the most contamination and pollution continue to be the communities of minority backgrounds.
So I'll talk a little bit more about the groups we've reached out to for feedback, for help, for just sharing what we've done. And we've reached out to a number of different groups, including the Domenici Lab, and they're the really cool researchers who sparked this big conversation around how PM 2.5 affects health and even COVID-19 mortality rates, and how it disproportionately may affect people. And we've been able to foster kind of like a collaboration where we have a few of our student data analysts kind of reach out and work with their group and kind of volunteer and learn more from them. And we've reached out to others to get more feedback on our GIS map, and professors at the University of Connecticut to get more feedback on how this may be leveraged as a policy tool and what we can further improve. And now we're presenting to you guys. And the real reason I think it's just so valuable to present, because we want to get that community level perspective and all the insights that you have and any interesting questions that you guys are thinking of right now with just some of these initial trends that may be used further in our work, or some sort of collaboration that we can foster between us. So we're really grateful to have had the chance to present to you all.
And I don't know, it's really like amazing to be presenting to you guys and to have been able to present to a bunch of the groups that you saw on the previous slide. I, for one, was not expecting to be involved with this group at all. Like I didn't know coronavirus visualization team was not a thing before March or April. And it's amazing to see how much of a valuable learning experience this has been for not only me, but for Manasa, Serene, and anyone a part of this team and this organization. People gain data analysis experience that had never been involved with it before. I learned how intersectional so many issues are, and how environmental justice really connects to everything. And we saw how these factors work within Massachusetts, and it really has taught us a lot about how to communicate about our findings and just how important community empowerment is, and community participation in every process, and just having that start from the local level. So thank you. Here are our emails and our names, and we'd love to hear any questions any of you may have.
I have one quick question, Celia DeRemus. Has any of this data been presented and being able to be used, in professional environments?
So are you talking about like the data we use to like kind of create the maps and some of our chart maps? Yes, for sure. The data that we utilize, it's all basically available to the public. It's accessible. It's been used in a number of different studies. We use the EPA air quality systems data. They have long-term records as well as more like short-term, like current present conditions too, with their Air Now system. So they're a great resource to check out. Also mass.gov also has, a lot of the data accessible there as well. But I guess if you'd like specific information, like we would love to share it with you, as well as some of the many data sets that we looked into.
I'm also thinking about what you've brought together, and are you going to be? That's what I was mainly interested in. Is are you going to be able to use everything that you've brought together and give it to some other organization to utilize as they develop their own policies?
That's a great question. I would say what we've done so far, it's a great tool for visualizing and just looking at the various trends that may be available. It might be a great, starting point for different questions and different things to look into more in depth. But in terms of like the statistical analyses, we haven't necessarily worked on some of the more complex ones, as we lacked much experience with that. But that's something we'd love to work on moving forward. So it's not, it's not like scientific literature. It's not public publication standards, obviously, but it's definitely a great starting point.
Right, it is.
Mm-hmm. I had a question. Actually, I put it into the chat, but I can also mention it verbally. That is, how did you come up with a feasible research topic, one that could produce worthy results in a decent amount of time? Because some of these questions could probably take years, and others would produce trivial results. So how did you come up with it?
So I would invite Manasa or Serene to join in for this question, but this question, that was a good question. That had been a question on our minds for a while when we first started with the project, because it's so easy to have so many questions that you'd want to explore, and not focusing in on them could reduce the quality and the quantity of the products produced. But I would say we started with our team and we saw what they were interested in, and we knew that we needed to include COVID data, demographic information, and pollution point sources. But a bunch of the visualizations that you saw evolved over time, and we kept asking questions about what else do we want to add to the maps. So I would say the first things we came in on were visualizing COVID data versus PM 2.5 or air pollution data. And then from there we expanded.
So I'm just gonna, I want to let Amy ask her question, but I just want to jump in and say we probably have time for about 4 more minutes of questions. So we'll just aim to wrap things up by 4:50.
Yeah, hi. First, I wanted to say you guys have done awesome work. No one said that yet, and I'm really impressed. When I looked at the maps yesterday, I figured this was graduate students' work. So kudos to you. This is excellent. My question is, have you had a chance to dig into any specific communities in Massachusetts? And also, why choosing Massachusetts, given that you're all over the place?
That's a great question. Once again, I'm welcoming my team members to add if they want, but I go to Northeastern University in Boston, and first semester I took for the fun of it an environmental justice course, Environment and Society. I never known about environmental justice before then. And in that class, we learned a lot about these trends as they exist within Massachusetts. And so coming in with that insight, we decided that we need to focus on a smaller area, possibly a state. And so when we were considering which states to use, I thought that Massachusetts might be good because I had learned a lot in the class and it was amazing to apply all that stuff. And it's so relevant and important that we look into. And as far as which communities, we were considering on going more in depth for Boston because I know redlining has created a lot of issues. And inequity is huge. And that would definitely be something that we would pursue in the future.
Sarah?
Yes. Have you gone to the press with this information? Have you reached out to the media at all?
Yeah, we've reached out to them like with a link to our visualizations, but they haven't been really responsive. It's actually really hard to pitch to journalists. Like I've emailed specific ones, a variety of, especially those who focus on climate like related topics. And I've also reached out to their editors, but it's just very hard to get them on the line. We've thought about like improving our pitching methods, but it's still like not very, it takes a lot of work to reach out to them.
Right about that.
So I just want to, again, thank our presenters. This is really incredible work, and I learned a lot. I will just say briefly from the perspective of my work, oftentimes I'm going to speak with policymakers, and being able to talk about the intersections of different crises is really important. Making an argument for reducing our emissions, reducing pollution this year has been hard because folks only want to talk about public health. And obviously pollution and public health are intrinsically linked. So whenever we can make those intersections clearer for folks, it's really, really helpful. And luckily we were able to do some of that and passed at least one good piece of legislation, or one good piece of legislation this year. But yeah. So I'm gonna have to take back the facilitation for a minute to go through a few standing items on our call, but I would invite our presenters to stay on if they like. And Serene, others, do you have any just like last words you want to say? Anything else you want to share?
I guess first off, thank you all for listening in and for all your enthusiasm for what we presented. I know I'm super excited by your group to see all of you guys come together and be able to just discuss and fight for legislation that is important for our community, our environment, public health, every aspect, because they all relate. So just thank you all.
Yeah, I just also want to commend you guys. It's, you know, when you guys sent the deck to me originally, I was like, oh my gosh, wow. So, you know, I guess to answer Celia's question also, like, I think that we can, you know, help facilitate, you know, bringing your research to our allies, because a lot of different organizations across the state will really benefit from this work. So I just really want to thank you for bringing it to us, and we're happy to facilitate getting it out there.